I'm Dr. David Morwood. I am a board-certified plastic surgeon here on the beautiful central coast of California, right here in Monterey, Pebble Beach, and Carmel, and Pacific Grove. Thanks very much for being here for this segment. What I'd like to discuss is some of the mechanics of the natural neck lift or facial rejuvenation, the recovery period. I think that's very important, and how adjunctive procedures such as chemical peels, TCA peels, croton oil peel, the croton oil phenol peel, or facelifting, in addition to the natural neck lift, how that can change the recovery period, what the recovery period is like, and talk a little bit more about the mechanics of how we choose where to do the operation and issues like that. First of all, I want to review. You've heard me talk about the triangle of beauty or triangle of facial rejuvenation. Every triangle has three parts. There's the skin, there's volume changes, and then there's soft tissue position and amount. That triangle rests upon a foundation. And of course, the foundation is the craniofacial skeleton, of course. Now, you know about the skin. That's the texture of the skin, the superficial skin. And we treat things like age spots, fine lines, wrinkles with treatments such as laser or croton oil peels or TCA peels. That is not a replacement for a facelift, but what I feel strongly about is that for effective, natural appearing or natural resulting, long-lasting, high-quality plastic surgery, we need to address all those components separately. Now, you don't necessarily have to, you're not going to get a guarantee that you have to have a peel if you have a natural neck lift, but what we need to do is design a custom approach, a custom designed approach for you based on what you need. And the principles in my practice of designing a custom designed approach, a custom approach, is to follow the triangle of beauty or triangle of facial rejuvenation. So there's the skin. So we're talking about the texture, fine lines, pigment changes, hyperpigmentation, liver spots, aging spots, etc. Those are best treated with things like chemical peels, sometimes laser, etc. Then there's volume changes. You've heard me talk about, as we mature, we tend to lose fat in the face and in our hands, and we put fat on in the trunk. That's an unfunny practical joke. But there certainly are volume changes. Now, how do we revolumize? How do we reverse some of those changes? The first easy way, when you don't need a lot of revolumization, is with fillers. Things like Juvederm, Restylane, Belotero, Voluma, etc. Those are volumizers that can help restore volume. We can bring the chin forward a little bit. We can augment the cheekbones. We can accent the mandibular angles. We can fill in the hollow temples, etc. So those are fillers. What's the other broad category of revolumization? That is with fat grafting. Fat grafting is when we do conservative liposuction from somewhere where the fat cells typically persist, like the trunk, love handles, the lateral thighs. Some people call those the saddlebags. I'm not allowed to use that term in my office. My wonderful staff doesn't allow that. However, they do allow me to call men's prominences the love handles. I'm not sure why we have that gender difference. But we take fat from the trunk, we spin the fat down, and then keeping it sterile, we sometimes cleanse or decant the fat, and we can re-inject it to, say, restore cheekbones, fill in what we call submalar hollowing, accent the mandibular angles, bring the chin forward, help to restore the foundation for the nasolabial folds or the piriform sinus areas, fill in the temples. So that's a person's own fat. And we recreate. It's a lot like Johnny Appleseed. We spread out these seeds, but in very specific places. Some of them will take, some of them will not. About 67% of the volume will persist. And it's a person's living cells. If a person ever gains weight, their cheekbones will get bigger, just like if they have not had fat grafting. If they lose weight, things will get smaller. It's your tissue. It's living, breathing, bleeding. it needs blood supply, etc. It's you. It's sort of a natural replacement for that fat that's lost with hormonal changes as someone matures. I've heard women say, I feel like I've become from a plum into a prune, or I've turned from a grape into a raisin. So what we want to do is have a volumetric restoration. We want to lift and fill. We don't want to pull so hard and remove extra skin. We don't want to pull so hard until the wrinkles disappear and then cut off the extra skin and sew up. That may be the older way to do a facelift, or the more traditional way to do a facelift. What we want is a projecting face. We want full cheekbones. We want full cheeks. Think of a baby with lots of fat in the face. So we talked about the skin part of the triangle. We talked about the volume part of the triangle. Now, what about the soft tissue position and amount? That's what people typically think of as plastic surgery. We're lifting, we're removing some skin, we're repositioning, we're firming up. And so in my practice, again, we need to look at the individual components that rest upon the foundation. Sometimes we bring the chin forward, sometimes we adjust the ears or the nose, cheekbones, etc. You don't have to, you're not mandated to sign up for all three parts of the triangle. But I think we should talk about what you need. Have you lost volume? What part of your face and neck are we going to address? The eyes, etc. And I think we've entered an era where it's component restoration. You can just have what you want done. You don't have to have whatever that phrase complete facelift is. You don't have to have a complete facelift. You can if you want. It's not required. You can have only the eyelids done, only the neck done, only the mid-face done if you'd like, etc. So I want to talk a little bit about the logistics and mechanics of these operations. Probably in other of my other teaching segments of mine, other teaching videos, you can learn more about, say, the actual operation of the neck lift. We go step by step. We address the surface of the skin, the amount of the skin, the subcutaneous fat, the platysma muscle, the subplatysmal structures, and we need to go, and the chin and the jaw, etc. We need to go step by step and layer by layer. Now, for facial rejuvenation, it's a similar thing. We need to address the triangle of beauty. We need to address each component, at least talk about them so you understand your options. And probably during your first consultation, we'll do the computer imager, the Vectra. That's a $40,000 piece of technology that my patients really enjoy. It's 6 cameras attached to a computer. It takes just an instant to have your image taken. All 6 images are fed into the computer, and it's sort of like computer-aided design. We can rotate you, you're in 3 dimensions, we can look at you upside down, we can do some sculpting, molding, tailoring, etc. to give you some idea, not a guarantee, but some idea of what's going to go on. So, the mechanics of it. How do we choose where to do an operation? First of all, in my office operatory, we have a very functional, I like it, very functional, usable office operatory. We have an autoclave, we have tons of betadine, sterile instruments, on and on, new sutures, and whatever you need, we have that's sterile and clean, etc. We have a great light. I put on my fiber optic light. We have loop magnification. We have an overhead light. We have overhead exhaust, etc. But in the office, we don't start an IV. So what is it that we do? You can come in and take sedatives. If necessary, if you would like, you can get a whiff of the nitrous oxide oxygen mix. We take your vital signs. You can get an oral sedative, not an IV, but an oral sedative. You can take a Benadryl, Tylenol. Sometimes we give a narcotic, and it's certainly an antibiotic. We let all that soak in or take effect, and then I start to numb. And numbing is done with a needle, so that can sting. And that's when sometimes people will take a whiff of the nitrous oxide. Some people call it laughing gas. It's in a lot of doctors' offices. Now it's used in the emergency room. Even children can get it. It's used in labor and delivery for women in labor, takes away the edge of the pain. It's a dissociative medicine. You might feel the sting of the needle, but it really doesn't bother you. I find my patients really like it. And you're being monitored. We check, as I said, your pulse oximeter is constantly being monitored. We check your blood pressure, we check your pulse, etc. So we numb up the skin after you're sedated, but with the oral agents, the pills. Then when that soaks in, we numb up the deeper tissues. I use a very dilute local called Hunsted's formula, and that doesn't feel so bad. But then we let all that soak in. So you're very relaxed, you're numb, but you're awake and you're being monitored. We don't start an IV and we don't intubate people in the office. That's good for people who don't have uncontrolled medical problems, if you don't have diabetes, if you don't have high blood pressure, if you don't have any cardiac history, no lung problems, if you're in good shape and you're young, and if you're of the kind of personality that you can relax. If you simply can't relax around needles and medical discussion and instruments, well, then you probably need to go to the next step. Now, what's the next step? The next step, I'm going to group together the outpatient surgery center at the hospital or the surgery center. We're lucky that there's a surgery center in my building, and there's a facility on nearby, just 2 blocks away on Cass Street. What happens there? An IV is started, and those same medicines, a sedative, antibiotic, narcotic, is given right in the vein, and you can tell the anesthesiologist how deep you want to go. You can take a nap, you can get a deep general, a light general, you can get sedated, you can go twilight, you can get sort of daydreamy, and then I numb you up. And we want you to be comfortable. We don't want anything to bother you. I numb you up the skin, numb up the deeper tissues. You can take a nap if you want, as I said. You can just request whatever you want and speak to the anesthesiologist. Of course, there's another nurse and an assistant, a scrub tech, the anesthesiologist in the facility. That has some increased costs. However, for the person who needs that or wants that, it's certainly well worth it. Certainly well worth the cost. And that's done either at outpatient surgery center at the hospital or at the accredited, licensed, and certified, licensed, accredited, and certified surgery center, Monterey Peninsula Surgery Center here in Monterey. And there are a number of campuses. Now, you can have your operation. We watch you in the recovery room. If we do this in the office, we watch you for a while, and you can walk out by yourself. You don't have to stay overnight at the surgery center or even the hospital. Now, in some instances, you have an option to stay overnight if we plan this out ahead of time, or if there's some necessity to keep you overnight at the hospital or the surgery center. But you don't need to, say, for the natural neck lift or facial rejuvenation. If it's done in the office or at the outpatient surgery center, you leave, and we see you in the office the very next day. Now, what about the recovery period? I want to talk about the recovery period for the natural neck lift, depending on what you have done, for most types of facial rejuvenation, and then I want to talk about the adjunctive procedures for fat grafting and peels, whether it's a TCA peel or croton oil phenol peel. Now, just the natural neck lift or facial rejuvenation, the facial, let's say, face lifting or elevation alone. As I said, rest and elevate and take it easy at home for 3 days and 3 nights. Doesn't mean lay in bed. We don't want you to lay in bed. Short walks to the kitchen and to the bathroom and maybe check the mail, that's okay. But this is your time to be home and listen to your favorite Mozart records or Beatles records, or watch Turner Classic Movies, catch up on email, or write letters if anybody writes letters anymore. Just hang out and be mellow. Rest and take it easy at home for 3 days and 3 nights. We want to see you in the office the very next day. For most of these procedures, you can shower that night, 24 hours after the operation, or you can wait till the next morning if you want. A light dressing for a day and a half is all you need. Then on day 4, a little more activity, but don't get your blood pressure up high. Walking the rec trail is fine, easy walking, easy elliptical strider, easy stationary bike, easy on the treadmill walking, but no pumping iron, no hard jogging, no sprinting, no lifting really heavy amounts. You just go easy starting on day 4, a little more activity. Fresh air is good. We have a lot of people who get a baseball cap and a pair of sunglasses and a scarf, and they walk the rec trail from Monterey and Carmel to Pacific Grove, etc. Feels good to walk. Showering is good. Then on day 11, slowly get back to your life. By that day, or 10 or 12, if we use some staples behind the ears, they're coming out. The sutures are starting to melt. And we have plenty of people on that day 4, a little more activity, who will go to their desk, work on the phone and do paperwork, etc. On day 11, a lot of people are interacting with the public. The swelling and bruising is probably less than you anticipate. So on day 11, it's slowly progressed to your life. Now, what about if we add fat grafting? And what about if we add a peel, such as a TCA peel or the phenol croton oil peel? You're going to be swollen and bruised for about 3 weeks. You're going to be overcorrected if we do fat grafting. I don't think you're going to want to have a portrait picture taken for 3 weeks. So you're overcorrected. As I said, about 67% of the volume persists, and so we want to overcorrect. You're overcorrected for about 3 to 6 weeks. Usually the bruising is not all that bad. There is some swelling, but typically you're going to look sort of chipmunk-cheeked, and you're not going to want to go to a dinner party for about 3 weeks. Now, what about the peel? TCA peel or croton oil peel? Overall, not that much happens for 5 or 6 days. And then for 5 or 6 days, you exfoliate, you peel, you shed. Then you have smoother, pinker, softer skin. It takes about 6 weeks for the pink skin to fade away. You can put makeup on it, but most people aren't that comfortable going to a dinner party without makeup or having a portrait photograph taken for those few weeks. You're going to want to wear makeup after the exfoliation period finishes, which is at about day 12, 10 or 12 after the peel is done. 5 or 6 days, not much seems to happen. 5 or 6 days of rapidly exfoliating. Now the TCA peel and the croton oil phenol peel, to talk about the differences will take us about half an hour or 20 minutes. We can do a segment on those. Oftentimes with the croton oil phenol peel, I'll do a bismuth mask we tape overnight, then the next day take the tape off, apply a bismuth mask. It's sort of like a green mask that you wear. That'll come off after about 10 days. For the TCA peel, it's a lot of antibiotic lotion, emollients, and lubricants. But the point I'm trying to make is that if we do fat grafting and or a peel at the same time we do the natural neck lift or the lifting for facial rejuvenation, your recovery period will be extended. You're not going to want to go to a dinner party at about day 10 or 11. If we do the lifting alone, it's a reasonably rapid recovery. Now, doing the fat grafting and TCA peel is a longer recovery, but it's more change. You're going to get more rejuvenation if you need it. It's more powerful if you need it. So one of the important take-home lessons is a custom designed approach is really the best for you. If you only need a peel, if you only need fillers, if you only need Botox, if you only need a natural neck lift, just have what you want and need, nothing more, nothing less. But the more invasive the procedure is, typically the longer the recovery period and the more invasive the procedure is, it's probably more powerful and the effect is more profound. So my advice is custom designed approach. Take the time, be educated, sit with me, go through the facial analysis. We go through layer by layer, do the vector computer analysis. We can talk about potential result, possibly do some sculpting for you. And keep in mind, a natural result usually comes more consistently with following the triangle, the triangle of facial beauty, triangle of facial rejuvenation. The triangle lays upon on top of the foundation, and also keep in mind the more invasive the procedure, likely to be more recovery period and a more profound effect. So I hope that's helpful for you. If you want any more information about the natural neck lift, about facial rejuvenation, about the triangle of beauty, about peels, about revolumizing with fat grafting, I hope you'll call my office, 831-646-8661, or go to my website, drmorwood.com, drmorwood. Thank you, Michael Martins, in the control booth. I'm Dr. David Morwood. This is the Doctor is In television program. Thank you very much for being here.